Hello everyone. Okay, can you listen to me? Okay. Uh, Welcome. I'm Dr. Faridul Islam. I'm going to take a class on artery supply of the whole body. And at first, I want to give my resume that I graduated my MBBS from East West Medical College, and in 2020, I completed my MRCS from Royal College of Surgeons of Edinburgh. So, before starting the session, I would like to give a brief idea why I take this kind of session. So the thing is that the medical students, mainly the first and second year medical students, are not uh, well oriented with this artery supply and of the whole body. And even though in post graduation, we also not that much oriented with this kind of education, where we can know that there is something, the artery supply, whole body artery supply is well organized in somewhere. So I'm going to give a brief idea, and this is a Zoom live session. We have some participants, and after this session we will ask if they have any questions regarding this thing. We'll ask them and we will carry on. And if you are seeing this in Facebook, you can comment on the Facebook. You can comment on this section, live section, and we will read you and we'll try to give the answers if you have any questions regarding this. Okay. Well, I'm going to start now. Okay. For today, we will discuss these topics, mainly the branches of different arteries and from where they are origin, and some artery has important vertebral level. We will discuss about that, and after we discuss the whole arterial system, then we will discuss what are the organ specific artery supply, and after that we will take some question and answers. So the first thing, if we take it that the heart is the center of everything in our body, at least for blood circulation, then the left atrium will play a vital role. And from the left atrium, we will see that the aorta is the main branch which origin from the left ventricle. So the aorta is the main thing which originates from the left ventricle, and we divided the aorta into four distinct sections: the ascending thoracic aorta, the arch of the aorta, the descending thoracic aorta, and the abdominal aorta. Now, the ascending thoracic aorta is the portion which is closely related with the left ventricle. It just ascend. It is a small segment of the aorta. Then in the left side, we are saying that it is a picture of heart, which the arch of the aorta. And after that, there is a long section in the descending thoracic aorta, and also the abdominal aorta, which when the aorta is crosses the diaphragm and then enters into the abdominal cavity, and we call it abdominal aorta. So we start with the ascending thoracic aorta or ascending aorta. The ascending aorta has mainly two arteries, which is right coronary artery and left coronary artery. These two arteries originated from the aortic sinuses, which is situated in the uh, ascending aorta, and these aortic sinuses give origin to right aortic sinus, give origin to right coronary artery, and left aortic sinus gives left coronary artery. After that, um, After that, we will see that the right coronary artery has some branches and the left coronary has some branches. The right coronary artery has right marginal artery, posterior interventricular artery, sternodal artery, AV nodal branch, and infundibular artery. On the other hand, left coronary artery has mainly two branches, circumflex artery and anterior interventricular artery. The circumflex artery gives another branch, which is left marginal artery. We will go to a picture and we will see that what are the branches. The right coronary artery and the left coronary artery is mainly supplied the heart itself. So it is very important to know what are the branches when we are doing any cardio picture or any intravenous picture of the coronary arteries. We have to know that which artery we are in and where there is any block or not. So these are branches where they are situated. It is very important. So if we look at this picture, this is the right portion and this is the left portion of the heart. On the upper picture, we see that if this is the ascending aorta, this is the right aortic sinus and the right coronary artery comes from here. And the right coronary artery gives marginal artery. And if you look here, this also gives posterior interventricular artery. And there is also infundibular artery and sternodal branch and AV nodal branch from the right coronary artery. On the other hand, the left coronary artery gives mainly the anterior interventricular branch here and the circumflex branch here. And the circumflex branch gives origin to the left marginal branch. So this is how the heart is getting its whole blood supply through the right coronary artery and the left coronary artery, which is a branch of ascending thoracic aorta. Okay, now after the ascending thoracic aorta, we reach the arch of the aorta. From our medical colleges, we always use this mnemonics that the BCS, that means the arch of aorta has three branches. From right to left, it is brachiocephalic trunk, left common carotid artery, and left subclavian artery. From the brachiocephalic trunk, we see that there is right common carotid artery and right subclavian artery. That means we have two right common carotid artery. We have two common carotid artery. One is right common carotid artery and one is left common carotid artery, and two subclavian artery, which is right common carotid artery, left subclavian artery, and left subclavian artery. And the right common carotid and right subclavian artery are a branch of brachiocephalic trunk. So if we see this picture, this is the arch of aorta, and from right to left, we think this is the brachiocephalic trunk, this is the left common carotid artery, and this is the left subclavian artery. If we see here that there is the name of, this is the brachiocephalic trunk, there is another name of this, that is innominate artery. That means the artery which has no name. So the brachiocephalic trunk is divided into two branches, that is right common carotid artery here and the right subclavian artery here. So we see that there is some branches from right common carotid artery, right subclavian artery, left subclavian artery, and also we'll see some branches of common carotid artery in the next section. Okay, now the common carotid artery, we already see that we have two common carotid artery, right common carotid artery and left common carotid artery. So we will discuss about one of them, either right or left. So if we fix it common, that it is common carotid artery, we'll see that the common carotid artery is further divided into two carotid arteries, that is external carotid artery and internal carotid artery. The external carotid artery is further give 8 branches and the internal carotid artery gives 6 branches. The external carotid artery gives superior thyroid artery, ascending pharyngeal artery, lingual artery, facial artery, occipital artery, posterior auricular artery, superficial temporal artery, and maxillary artery. We're going to see a picture of external carotid artery. If we look the picture of the right side, this is the common carotid artery, and it is bifurcate here. And this level of the vertebral level of this section is important, because the vertebral section, the vertebral level of the common carotid artery into bifurcate into right external carotid and internal carotid artery is the lower border of the cervical 3 vertebra. Okay, then it divided into external carotid artery, and inside it is internal carotid artery. The external carotid artery goes up and it runs through the parotid gland, and it goes up to the anterior side of the ear and posterior side of the ear by giving branches. So if we look at the branches, the first branch of external carotid artery is superior thyroid artery. This is very important. The superior thyroid artery is the first branch of external carotid artery. After that, we find that this is the ascending pharyngeal artery, this is lingual artery, this is facial artery, this is occipital artery, this is posterior auricular artery. And the termination of the external carotid artery is done by two branches, which is maxillary artery and superficial temporal. If you see here, the external carotid artery divided into maxillary artery and superficial temporal artery, then it's finished. So it is important to know that the maxillary artery and superficial temporal artery is the terminal branches of the external carotid artery, and the first branch of the external carotid artery is superior thyroid artery. Now, the internal carotid artery. The internal carotid artery give branches of 6 arteries, and there is just some minor branches. I'm not going to talk about the minor branches. I'm talking about the main important branches of every blood vessels. So the internal carotid artery has anterior cerebral artery, middle cerebral artery, ophthalmic artery, anterior choroidal artery, posterior communicating artery, and superior hypophyseal artery. So if we look the picture on the right side, we'll see that the external carotid artery enters into the skull through carotid canal, and it goes into the cavernous sinus here. It goes inside the cavernous sinus and also in front of the cavernous sinus. If we see a picture of cavernous sinus, we will see that the inside the cavernous sinus, we have the internal carotid artery also in front of the cavernous sinus, because it slopes like this. So after that, it enters into the brain, and it gives branches such as ophthalmic artery. If we see here, this is ophthalmic artery, this is anterior cerebral artery, this is middle cerebral artery, and the posterior cerebral artery is not shown in this picture, but this is the posterior communicating artery, and there is also choroidal artery and posterior superior hypophyseal artery. So the main thing we have to know that the brain gets its blood supply mainly from this internal carotid artery and also the vertebral artery. This thing is important. They form circle of Willis inside the brain, and they gives the blood supply of the whole brain. So internal carotid artery plays a vital role in if we talk about the brain blood supply of the brain. Okay, the next section will go that we already discussed about the arch of the aorta has three branches: common carotid, brachiocephalic trunk, left common carotid, right subclavian, left common carotid, and left subclavian. So now we will discuss about this subclavian artery. There is two subclavian artery. One is right subclavian artery and one is left subclavian artery. The right subclavian artery gives 5 branches. The mnemonics here is vitamin CD, V for vertebral artery, I for internal thoracic artery, T for thyrocervical trunk, C for costocervical trunk, and D for dorsal scapular artery. Sometimes some books and some journals show that the dorsal scapular artery is a branch of thyrocervical trunk, and sometimes in some books there the dorsal scapular artery is a direct branch of subclavian artery. So there is some debate between these two things, so we'll not go there, but the dorsal scapular artery will read that the dorsal scapular artery is branch of subclavian artery. If they give option thyrocervical trunk, then we will go for thyrocervical trunk. Now we will discuss about this picture where we are seeing that this is the subclavian artery, and the subclavian artery has also 3 parts. The part 1, this is the part 1, this is the part 2, and this is the part 3. The continuation of the subclavian artery, when it crosses the lower border of the first ribs, it became the axillary artery. Okay, this is very important. We are talking about the branches, not its continuation. We will talk about it later. The branches of the subclavian artery, if we see here, this is the vertebral artery, this is thyrocervical trunk, this is internal thoracic artery, this is subclavian artery, and this is costocervical trunk. And the costocervical trunk has 2 branches. It is deep cervical artery and superior intercostal artery. Okay, now next, the vertebral artery. The vertebral artery plays a vital role in giving the artery supply of the brain. So we should keep in mind that we should have clear concept about the vertebral artery. So what happens when the vertebral artery originates from the uh, subclavian artery? It runs in between the transverse foramina of the C6 vertebra, cervical 6 vertebra, and it goes up to the cervical 1 vertebra, which is atlas, and it goes backward. Then it goes upward and front and upward and medially. We discuss this later. The course of the vertebral artery, it is very important. You have to understand the course of the vertebral artery. And the branches of the vertebral artery is anterospinal artery, posterior inferior cerebral artery. These are the branches. And the vertebral artery, ultimately, there is two vertebral artery, one from the right side, one from the left side. Both vertebral artery joins to form the basilar artery. So, and the posterior inferior cerebral artery also give rise to posterior spinal artery. That means anterior spinal artery is a direct branch from vertebral artery, but posterior spinal artery is a branch of posterior inferior cerebral artery, which is a branch of vertebral artery. Okay, now talk about the basilar artery. When the two vertebral artery joins to form the basilar artery, we will see the picture later. The basilar artery gives origin to branches to anterior inferior cerebral artery, labyrinthal artery, pontine artery, superior cerebral artery, posterior cerebral artery. Okay, now look at this picture. We talked that the vertebral artery gives mainly two branch, which is uh, anterior spinal artery. This is the anterior spinal artery. These are the vertebral arteries. This is the anterior spinal artery, and this is the posterior inferior cerebral artery. Then these two vertebral artery joins to form the basilar artery. This is the basilar artery, and this is the posterior inferior cerebellar artery, and this is a posterior superior cerebellar artery. This is labyrinthine artery, and there is also pontine artery. This is the posterior cerebral artery, and by the basilar artery is divided into right posterior cerebral artery and left posterior cerebral artery. Okay, now next, the another branch of subclavian artery is internal thoracic artery. Okay, the internal thoracic artery give branch to 8 distinct arteries, which are pericardial artery, mediastinal artery, perforating artery, sternal artery, anterior intercostal artery. Please keep in mind that the first to sixth, 1, 2, 3, 4, 5, 6 intercostal spaces are supplied by anterior intercostal arteries, and it is originated from the internal thoracic artery. But the 7, 8, and 9 intercostal spaces is supplied by anterior intercostal artery, which are branch of musculophrenic artery, which are branch of internal thoracic artery. So it is very important. We will see the picture later. And there is the other branches is pericardiophonic artery and supraepigastric artery. For Bangladeshi students, we are using some mnemonics for memorizing these branches. That is Priya, More, Pashe, Shue, Anatomy, Pore, Shonao, More. So it is easy to memorize the branches, and we can memorize it easily. So if we look at this picture, this is the subclavian artery and this is the internal thoracic artery. The first 6 intercostal space is supplied by anterior intercostal artery, which are direct branch of internal thoracic artery. And there is also perforating artery and also sternal artery. And where is the superior epigastric artery? And this branch is musculophrenic artery, which give rise to 7, 8, and 9 intercostal space blood supply by forming anterior lower 3, 7, 8, 9 intercostal artery. Well, we will go to the next. Then thyrocervical trunk, the another branch from subclavian artery is thyrocervical trunk. It gives branches, the main 3 branches: left inferior thyroid artery, transverse cervical artery, and suprascapular artery. The inferior third artery give inferior laryngeal artery and ascending cervical artery. The transverse cervicalis arteries give branches to superficial cervical artery. If we look at this picture, this is the thyrocervical trunk, okay? And this is inferior thyroid artery, and the inferior thyroid artery gives branch to inferior laryngeal artery and ascending cervical artery, okay? And where is suprascapular artery, here is transverse cervical artery, and this is superficial cervical branch of transverse cervical artery. Okay, this is the thyrocervical trunk. Then now the continuation of the subclavian artery. We told you that the subclavian artery is uh, the branches from the subclavian artery are those 5 branches, but the subclavian artery, the main function of the subclavian artery, it supplies the neck area, and also the some branches give artery supply to the brain area, and they give the arterial supply to the upper limb. So it has to go to the upper limb. When it crosses the first ribs, we call it axillary artery. And when it crosses the teres major muscle, we called it brachial artery. If you look at this picture, this is the subclavian artery. When this part is the subclavian artery, and when it crosses the lower border of the first ribs, from here to the lower border of the teres major muscle, this is the axillary artery. And when it crosses the teres major muscle, the axillary artery crosses the teres major muscle, lower border of the teres major muscle, we call it brachial artery. So the subclavian artery crosses the lower border of the first ribs and become axillary artery. When the axillary artery crosses the lower border of the teres major muscle, it becomes brachial artery. And if you look carefully, there is another muscle which goes in front of the axillary artery. This muscle is pectoralis minor, and the pectoralis minor divided the axillary artery into 3 divisions: the first part, second part, and third part. The first part is the area where uh, it is situated just upper side of the pectoralis minor muscle, and the second part is situated just below the pectoralis minor muscle, and the lower portion is situated just inferior to the pectoralis minor muscle. So if we see the axillary artery here, so axillary artery has 3 parts, and our axillary artery is a continuation of the subclavian artery, right? So axillary artery has 3 parts. The first part is the superior to pectoralis minor muscle. The second part is just beneath the pectoralis minor muscle, and the third part is inferior to the pectoralis minor muscle. And what are the branches? From the first part, the axillary artery gives only one branch, that is superior thoracic artery. From the second part, it gives 2 branch, mainly lateral thoracic artery and acromiothoracic artery. The acromiothoracic artery has several branches, which are acromial branch, deltoid branch, clavicular branch, pectoral branch. And the third part of the axillary artery gives 3 branches: anterior circumflex humeral artery, posterior circumflex humeral artery, and subscapular artery. If we look at this picture in the right side, below downside picture, we see that the first part gives rise to superior thoracic artery. The left part gives 2. Okay, this is the thoracoacromial artery, and this is the lateral thoracic artery. The thoracoacromial artery has several branches. This is the clavicular branch, this is the acromial branch, this is the deltoid branch, and this is the pectoral branch. And the third part gives anterior circumflex humeral artery, posterior circumflex humeral artery, and subscapular artery. If we follow it, the subscapular artery is going backward. Okay, now what happens to the brachial artery? When the axillary artery crosses the teres major muscle, it becomes brachial artery. What happened to the brachial artery then? The brachial artery then gives 3 main branches, which is profunda brachii artery, superior ulnar collateral artery, and inferior ulnar collateral artery. And it terminates by giving radial artery and ulnar artery in antecubital fossa. And the radial artery goes the posterior aspect of the hand and from the deep palmar arch, and the anterior ulnar artery from the superficial palmar arch and the palmar digital artery. If you look at this picture, the brachial artery is ongoing, and this is the brachial artery, the profunda brachii branch. This is the superior ulnar collateral branch. This is the inferior ulnar collateral branch. And in the antecubital fossa, it gives the radial artery and ulnar artery. There is some minor branches in from here. I'm not going to talk about that. If you are really interested in knowing those branches, you have to read the main books and also see the books where the pictures is demonstrated. After the radial artery forms the deep red is the deep palmar arch. The radial artery forms it, and the ulnar artery forms the superficial palmar arch and gives the digital branch, palmar digital arteries. Okay, now we know that the aorta is originated, then it forms the ascending aorta, then arch of the aorta, now descending thoracic aorta. The descending thoracic aorta has 6 branches, 9 branch of posterior intercostal artery, and the posterior intercostal artery is start from the third space, third, fourth, third to 11th, posterior intercostal artery, then superior phrenic artery, esophageal artery, pericardial artery, mediastinal artery, and 2 bronchial artery. Okay, if you look at this picture, this is the descending thoracic aorta. If we follow here that these are the posterior intercostal arteries, and it started from the third intercostal space. The first 2 are originated from the subclavian artery or thoracic trunk, but the lower portion, the 3 to 11 is supplied posterior intercostal artery is from descending thoracic aorta. And there is also some esophageal branch, and this is the bronchial branch, and there is other branches from descending thoracic aorta. Now, when the descending thoracic aorta goes to the abdomen, it has to pass through the diaphragm, and there is 3 foramen through the 3 foramen of the diaphragm through which different structures pass through, and the most posterior foramen is aortic opening, and it runs through the aortic opening and it enters into the abdominal cavity. Now, in the abdominal cavity, the abdominal aorta, when it enters into the abdominal cavity, it's known as abdominal aorta. Now, the abdominal aorta artery gives a numerous number of arteries, and the vertebral level of each and every artery is very important. If we discuss that in different exams such as MRCS or even in FCPS-MS, the vertebral level of this artery is asked different times with different type of questions. So if we talked about the abdominal aorta, if we look at this picture, we have 3 central branches. This is celiac trunk, this is superior mesenteric artery, and this is inferior mesenteric artery. If we look at their vertebral level, the celiac trunk is originated from the lumbar 12 vertebra, opposite to the lumbar 12 vertebra. The superior mesenteric artery originated from the lumbar 1 vertebra, and inferior mesenteric artery originated from the lumbar 3 vertebra, and these arteries are single. They are only one. Okay, then the paired bunch are at the level of thoracic 12. We'll see there will be inferior phrenic artery. The superior phrenic artery originated from the descending thoracic aorta, and the inferior phrenic artery is originated from the abdominal aorta at the level of lumbar 12. And if we see here, this is left renal artery and right renal artery, which originate from the lumbar 1, and sometimes the right renal artery is originated from the lumbar 2 vertebra at the in between lumbar 1 and 2 vertebra also. And from lumbar 1 to lumbar 4, in the side we see that there is pair of lumbar artery. Okay, and at the level of lumbar 1, there is another pair of artery, which is middle suprarenal artery, which is a direct branch of adrenal gland. This is very important. The adrenal glands get its supply from three arteries. The middle adrenal artery or middle suprarenal artery is originated from the it is a direct branch of abdominal aorta and originated at the level of lumbar 1. So the inferior phrenic artery originated from the thoracic 12, celiac trunk originated from the thoracic 12, superior mesenteric artery originated from the lumbar 1 and it is a central branch. Middle suprarenal artery originated from the lumbar 1. Renal artery, left renal artery is lumbar 1, but right renal artery is in between lumbar 1 and lumbar 2. The gonadal artery, in case of male, it will be testicular artery. In case of female, it will be ovarian artery. It will be originated at the level of lumbar 2 vertebra. And there is lumbar artery, which will be situated in level of lumbar 1, 2, 3, 4 on both sides. There is inferior mesenteric artery at the level of lumbar 3. Now, the terminal branches. And there is also a branch, a medial sacral artery, which is situated in the lumbar 4. The abdominal aorta is terminated by forming right and left common iliac artery. If we look at this picture, this is the right common iliac artery and this is the left common iliac artery. And at the level of lumbar 4, they divided into this right and left common iliac artery. This is very important. The abdominal aorta is divided into in right and left common artery, left common iliac artery at the level of lumbar 4, because we always misunderstand or we always give wrong answer when this is asked, because at the level of lumbar 5 the inferior vena cava is formed. So we should keep in mind that the abdominal aorta is finished at the level of lumbar 4 and the inferior vena cava is formed at the level of lumbar 5. This vertebral level is very, very, very important. We all should memorize this vertebral level with these arteries and from where they originate, which are the central branch, which are the pair branch, which gives which viscera or parietal type, these things. So now we will discuss about the first branch at the level of lumbar 12, the celiac trunk. The first central branch of the abdominal aorta is celiac trunk. So it originated at the level of T12 and it gives three branches: left gastric artery, common hepatic artery, and splenic artery. The common hepatic artery further gives four branches: right gastric artery, gastroduodenal artery, right hepatic artery, and left hepatic artery. The gastroduodenal artery gives again two branches: right gastroepiploic artery, superior pancreatoduodenal artery, and the right hepatic artery gives cystic artery. On the other hand, the splenic artery gives left gastroepiploic artery and short gastric artery. If we look at this picture, this is the celiac trunk, this is the left gastric artery, this is the splenic artery, this is the common hepatic artery. The common hepatic artery is further given. This is the gastroduodenal artery, this is the right gastric artery, this is the right hepatic, and this is the left hepatic artery. From the right hepatic artery, this is the cystic artery, and from gastroduodenal artery, we'll see that there is right gastroepiploic artery and superior pancreatoduodenal artery. Okay, this is the right gastroepiploic artery and superior pancreatoduodenal artery. Okay. Now, the second branch of central branch of abdominal aorta, which is superior mesenteric artery, which is originated from the lumbar 1 vertebra. The main thing of the superior mesenteric artery is it has close relation with the pancreas, and at first it's situated behind the pancreas and it goes through the pancreatic neck, and then it goes upward to the uncinate process and gives the blood supply to our gut. Okay, so the superior mesenteric artery, the course of the superior mesenteric artery is very important. The vertebral level of the superior mesenteric artery is very important. So the vertebral level is number 1. Now the superior mesenteric artery gives mainly 5 distinct artery, which is inferior pancreatoduodenal artery, jejunal artery, iliac artery, ileocholic artery, right cholic artery, and middle cholic artery. The ileocholic artery then gives the appendicular artery, which is an end artery which supplies the our our appendix, vermiform appendix. Well, if you look at this picture, uh, the superior pancreatoduodenal artery is not shown here. This is the superior mesenteric artery. Uh, this is the jejunal and iliac branches. That means the jejunal, it gives the supply to the our small intestine, and it gives the ileocholic artery. And in ileocholic artery, there will be appendicular artery. From here, there will be branch to give supply to the vermiform appendix. And then this is the right cholic artery, and this is the middle cholic artery. In middle cholic artery, if we see that the mainly, the supramesenteric artery gives the vessels which is situated or derived from the midgut. So up to the 2/3 of the right colon or transverse colon, right-sided transverse colon is derived from the midgut. So we always think that the middle cholic artery must be end here. No, the middle cholic artery is goes around the whole left colon or sometimes a part of the left colon. So if there is the other part of the colon is supplied by the inferior mesenteric artery, and which we will show in later. And if there is any injury or if there is an infarction of the inferior mesenteric artery because of this middle cholic arteries, this branch, the sign symptom will not that much severe. Okay, now the inferior mesenteric artery. The inferior mesenteric artery gives 3 branches. This is the left cholic artery. In the picture, this is the sigmoidal arteries, and this is the superior rectal artery. Keep in mind that the rectum is having one of its branches, one of its artery supply from the inferior mesenteric artery. That means inferior mesenteric artery gives superior rectal artery, and there is middle rectal artery and inferior rectal artery, which derives from the another vessels. So if we talk about the inferior mesenteric artery, the inferior mesenteric artery originated at the level of lumbar 3, and it is the central branch of abdominal aorta. It gives left cholic artery, sigmoidal artery, and superior rectal artery. Now, the abdominal aorta is terminated at the level of lumbar 4 by giving right and left. If you see this picture, by giving right and left common iliac artery. The right common iliac artery further divided into 2 branches, and left common iliac artery is divided into 2 branches. The right common iliac artery gives right external iliac artery and right internal iliac artery. The left one gives left internal iliac artery and left external iliac artery. So there is 2 external iliac artery, right and left external iliac artery, and 2 internal iliac artery, right and left internal iliac artery. Now, the external iliac artery. If we see in this picture, the external iliac artery, this is the external iliac artery, and there is a small amount of branches here. So the main 2 branches is from the external iliac artery is inferior epigastric artery and deep circumflex iliac artery. And when the internal iliac artery crosses the inguinal ligament, it becomes the femoral artery. If we see this picture, and when the inguinal ligament will be attached here, and when it crosses the inguinal ligament, the internal iliac artery crosses the inguinal ligament, it becomes femoral artery. This is the femoral artery. And before that, it gives the superficial epigastric artery and superficial circumflex iliac artery. When the femoral artery, the external iliac artery crosses the inguinal ligament, it becomes common femoral artery or femoral artery. Then the femoral artery gives 2 branches, profunda femoris and superficial femoral artery. The profunda femoris artery supplies to the anterior aspect and lateral aspect of the thigh by giving perforating artery, lateral and head of the our hip joint, and by giving perforating artery, lateral femoral circumflex artery and medial femoral circumflex artery. So if we look at this picture, this is the perforating artery, profunda femoris artery, and these are the perforating artery. This is the external or medial circumflex femoral artery. This is the lateral circumflex femoral artery. Okay, and this is the superficial femoral artery. Now, what happens to the superficial femoral artery? The superficial femoral artery, when crosses the abductor canal, abductor triangle, and or adductor hiatus, it crosses the adductor hiatus. It's known as popliteal artery, and it goes into the popliteal fossa. And at the lower border of the popliteus muscle, there is some minor branches from the popliteal artery. And at the lower border of the popliteus muscle, it gives anterior tibial artery and tibioperoneal trunk. Okay, if you see here, here will be the popliteus muscle, and lower border of the when it crosses the popliteus muscle, it gives branches to anterior tibial artery. Here, here is the popliteus muscle. This gives the anterior tibial artery and tibiofibular trunk. The tibiofibular trunk gives two branches, posterior tibial artery and fibular artery. The posterior tibial artery goes into the feet, and it gives medial plantar artery and lateral plantar artery. And the anterior tibial artery goes through the interosseous membrane, and it goes forward, and it goes into the foot, into the first wavy space, and gives artery dorsalis pedis. The artery dorsalis pedis goes downward into the deep plantar muscle to anastomosis with the lateral plantar artery, and from deep plantar arch. So I think everyone understand it. I would like to ask Rahat that if he understand it, if he understand the consequence of superficial femoral artery, how the superficial femoral artery ends. Dr. Rahat, can you tell me what I just mentioned here?
Yes, everything is crystal clear. You mentioned about the branches of the femoral artery and how it becomes the popliteal artery, and then anterior tibial and tibioperoneal trunk. After that, anterior tibial artery goes in front and as dorsalis pedis artery, and tibioperoneal trunk is divided into posterior tibial artery and fibular artery. And posterior tibial artery is then divided into lateral plantar and medial plantar artery. And lateral plantar artery is anastomosis with dorsalis pedis artery. Yes.
And it forms the
deep plantar arch in the foot.
Thank you, Dr. Rahat. Okay, I will go to the next slide. So that's how our lower limb almost gets its blood supply. This is the external. These are the branches of external artery, external iliac artery, and the femoral artery. And the external artery continues as femoral artery, and the branches of femoral artery. Now, what happens to the internal iliac artery? The internal iliac artery is divided into two branches, anterior division, and it gives two divisions mainly, anterior division and posterior division. If we see here, if this is the common iliac artery, this is the external iliac artery, and this is the internal iliac artery. This portion is internal iliac artery, and this is the posterior division, and this is the anterior division. That's how the internal iliac artery is divided: posterior division and anterior division. The posterior division gives three arteries. The first artery is iliolumbar artery. This is the iliolumbar artery. The second branch is lateral sacral artery. This is the lateral sacral artery. And the third branch is superior gluteal artery. So the internal division of internal iliac artery is, the posterior division of internal iliac artery gives three branches: iliolumbar artery, lateral sacral artery, and superior gluteal artery. And the external anterior division, internal iliac artery, anterior division give branches: superior vesical artery, obturator artery, middle rectal artery, inferior vesical artery, inferior gluteal artery, internal pudendal artery. In case of female, they gives vaginal artery and uterine artery. So if you see this picture, And this is the anterior division of the internal iliac artery. This is the umbilical artery, and this is the superior vesical artery. This is the obturator artery, and this is the inferior vesical artery. If it is a female, then uterine artery and vaginal artery, then middle rectal artery, internal pudendal artery, and inferior gluteal artery. If we look at this picture, the superior gluteal artery originated from posterior division of internal iliac artery. This is the superior gluteal artery. The inferior gluteal artery is derived from anterior division. The both branches, the superior vesical artery and inferior vesical artery, both comes from anterior division of internal iliac artery. The middle rectal artery, we already know that the superior rectal artery originated from the the superior rectal artery is originated from inferior mesenteric artery, right? The middle rectal artery originated from anterior division of internal iliac artery. This is the middle rectal artery, and the inferior rectal artery, that is superior, middle, and inferior, three branches for rectal. Yeah, the inferior rectal artery originated from the internal pudendal artery. The internal pudendal artery gives several branches, and there is also some external and internal divisions. So we will not discuss about that. We will just give the main 5 branches, which is formed by the internal pudendal artery. The internal pudendal artery gives inferior rectal artery. That means the rectum gets its blood supply from 3 major blood vessels. The superior rectal artery is from inferior mesenteric artery. The middle rectal artery is from the anterior division of internal iliac artery. The inferior rectal artery is a branch of internal pudendal artery, which is a branch of anterior division of internal iliac artery. So this concept is clear or not? I would like to ask someone, Tarin Zaman, can you listen to me? Tarin Zaman?
Hello?
Yes. Tarin Zaman, can you tell me the rectal artery, the superior, middle, and inferior rectal artery, where they come from?
Yes, first, superior rectal artery comes from inferior mesenteric artery, and middle rectal artery comes from anterior division of internal iliac artery.
And inferior rectal artery?
And inferior rectal artery comes from internal pudendal artery, which is a branch of anterior division of internal iliac artery.
Okay, thank you. Now, these are the branches. Almost these all are the branches of the abdominal aorta, and how they continues the whole of the this is the all for whole blood supply of the body. Now we will discuss some organ specific blood supply, which organ gets from which artery and from which origin. So if we think that the brain, if we start from the head, we'll see that the brain mainly receives its blood supply from the vertebral arteries. The 2 vertebral arteries will join to form the the basilar artery, and the basilar artery is divided into posterior cerebral artery, and it also gives several branches to the brain, and there is some branches from the internal carotid artery. Mainly the brain gets its blood supply from vertebral arteries and internal carotid artery. Now in the neck, the artery supply of the larynx is by the laryngeal artery. The superior laryngeal artery is originated from the superior thyroid artery. If we memorize clearly that the superior thyroid artery is a branch of external carotid artery, but the inferior laryngeal artery derived from the inferior thyroid artery, which is a branch of thyrocervical trunk. That means both thyroid gland and the larynx get its blood supply from superior and inferior thyroid artery. The superior thyroid artery is a branch of external carotid artery, and inferior thyroid artery is a branch of thyrocervical trunk. Okay. Now the blood supply of the pharynx. The blood supply, mainly the blood supply of the pharynx is by the external carotid artery, by giving some smaller vessels. And if we look at this picture, The external carotid artery give ascending pharyngeal artery, branches of facial artery, and branches of lingual and maxillary artery supplies the pharynx. Okay, now artery supply of the thyroid gland. The thyroid gland receives its artery supply mainly from the superior thyroid artery and inferior thyroid artery. Superior thyroid artery is a branch of external carotid artery. Inferior thyroid artery is a branch of thyrocervical trunk, which is a branch of subclavian artery, which is a branch of arch of the aorta. When we read these blood vessels, this arterial supply, we will go to the up to the origin. We memorize this, we will go up to the origin, then our concept of the blood supply will be clear. Okay, and there is another artery in 10% of the population. We see thyroid ima artery. This is very important, and there is question on MRCS exam that the thyroid ima artery from where the thyroid ima artery origins. The thyroid ima artery origins from directly from the arch of the aorta, and it is seen in 10% of the population. Okay, now the artery supply of the parathyroid gland. The superior parathyroid gland, there is two superior parathyroid gland and two inferior parathyroid gland. If you look at this picture, this is the inferior thyroid artery, and all the four parathyroid gland is supplied by inferior thyroid artery, which is a branch of thyrocervical trunk. Okay, next, artery supply of the trachea. The trachea is also supplied by the inferior thyroid artery, which is a branch of thyrocervical trunk, and bronchial artery, which is a branch of descending thoracic aorta. So the descending thoracic aorta give it branches. This is the descending thoracic aorta, and here will be comes from here there will become some brachial artery, which will give the supply of the trachea, and also the inferior thyroid artery. Arteries of the pleura. Now lungs. The pleura, there has two layers, parietal pleura and visceral pleura. The parietal pleura gets its blood supply from the intercostal artery, internal thoracic artery, and musculophrenic artery. The visceral pleura gets its blood supply from the brachial artery. And the blood supply of the lungs. The right lung gets its blood supply from one right bronchial artery, which originated from the posterior intercostal artery, and one right pulmonary artery. There is a reason because I write one, because in the left lung there is two left bronchial artery which arises from the descending thoracic aorta, and one left pulmonary artery. If you look at this picture, we will understand it. Okay, in the left side there is two brachial artery and one pulmonary artery. In right side there is one brachial artery and one pulmonary artery, which supplies the lung. Okay, we already learned that the heart is supplied by right coronary artery and left coronary artery. Where are the branches? There is also different branches from the right and left coronary artery. Now comes to esophagus. Okay, artery supply of the esophagus. We divided the esophagus into three distinct parts: the cervical part, thoracic part, and abdominal part. The cervical part is supplied by inferior thyroid artery, which is a branch of thyrocervical trunk. The thoracic part is supplied by the esophageal branch of descending thoracic aorta. So when we discuss about the descending thoracic aorta, there is some branches which is called esophageal branches. Okay, the abdominal part of the esophagus is supplied by the left gastric artery, which is a branch of celiac trunk. Okay, and the left gastric artery gives some branches to the esophagus. The stomach. This is really interesting that the stomach gets a lot of blood supply from a lot of vessels. The stomach gets its blood supply. This is the left gastric artery, which is a direct branch of celiac trunk, and celiac trunk is a branch of abdominal aorta. Then there is a right gastric artery. Right gastric artery is a branch of common hepatic artery, which is a branch of celiac trunk. Okay, there is gastroduodenal artery, which give rise to right gastrocolic artery. Okay, the right gastrocolic artery gets its blood supply here, and it originated from the gastroduodenal artery. The gastroduodenal artery is a branch of common hepatic artery. Then there is the splenic artery, which gives short gastric artery here, and left gastroepiploic artery, which is also a branch of splenic artery. Okay, artery supply of the duodenum. Gastroduodenal artery, there is a very important questions comes in any surgery, mainly related with the peptic ulcer diseases. When there is this in the second part of the duodenum, the gastroduodenal artery is situated just posterior to the second part of the duodenum. So when we do an endoscope, or we open the duodenum, if we see that there is bleeding vessels from the posterior wall of the duodenum, second part of the duodenum, the blood vessel we should keep in mind is that should be the gastroduodenal artery. That is the very important point to remember about the gastroduodenal artery. And it also give branches, which is right gastroepiploic artery and superior pancreatoduodenal artery. So the artery supply of the duodenum, there is superior pancreatoduodenal artery, which is a branch of gastroduodenal artery, inferior pancreatoduodenal artery, which is a branch of superior mesenteric artery, and branches from hepatic, right gastroepiploic, and supraduodenal arteries. There are several branches, but the main branches are superior pancreatoduodenal artery, inferior pancreatoduodenal artery. And there is some minor branches, which is hepatic, right gastroepiploic, and supraduodenal arteries give some branches to the duodenum. Now, the jejunum and ileum mainly supplied by the supramesenteric artery. If we see here, this is the left renal vein, and the supramesenteric artery come in front of it. This is a very important point also. The supramesenteric artery goes in front of the left renal vein. And if we see here, these are the branches of the supramesenteric artery, which supplies the small intestine by forming the rectus. Okay, and the supply of the colon, the whole colon is supplied by the right colon, left colon, and transverse colon. Whole colon is supplied by the superior mesenteric artery and inferior mesenteric artery. I already told you that the middle colic artery gives its branches up to its left side, descending colon. So if there is, and the inferior mesenteric artery also give the left colon some supply. All the supplies are from the inferior mesenteric artery. So if there is infarction of the inferior mesenteric artery and the patient shows slow sign symptoms, that because the superior mesenteric artery supplies the left colon with middle colic artery. That is the reason why in infarction of the inferior mesenteric artery, the sign symptom of this patient is slow progressing. Okay, the artery supply of the pancreas is superior pancreatoduodenal artery, inferior pancreatoduodenal artery, and pancreatic branch of splenic artery. The superior pancreatoduodenal artery comes from the gastroduodenal artery, which is a branch of common hepatic artery, which is a branch of celiac trunk. The inferior pancreatoduodenal artery is a branch of superior mesenteric artery, and which is a branch of abdominal aorta. And the superior mesenteric artery originated at the level of lumbar 1 into the abdominal aorta. Okay, the pancreatic artery, branch of splenic artery, which is a branch of celiac trunk. Now, the artery supply of the liver. The artery supply of the liver is by right hepatic and left hepatic artery and portal vein. It is really atypical that a vein is giving a blood supply to the liver, and mainly 75 to 80% blood supply provided by the portal vein. In liver, 75 to 80% of the blood supply is provided by the portal vein. Okay, and there is the other thing is supplied by the right and left hepatic artery, which is a branch of common hepatic artery. The blood supply of the gallbladder is by the cystic artery, which is a branch of right hepatic artery. The artery supply of the spleen, we have a splenic artery, which is a branch of celiac trunk, and the splenic artery runs in front of the pancreas, in front of the anterior border of the pancreas, and it enters into the hilum of the spleen. Okay, artery supply of the kidney, right renal artery and left renal artery, which is a branch of abdominal aorta. And there is some peculiarities about the renal arteries, and there is some branches of the renal arteries also. The inferior the suprarenal gland gets its supply from three vessels: the superior suprarenal artery, middle suprarenal artery, and inferior suprarenal artery. The superior suprarenal artery is a branch of inferior phrenic artery. Inferior phrenic artery gives branch to superior suprarenal artery. The middle suprarenal artery is a branch of abdominal aorta, and which originated at the level of lumbar 1. And the inferior suprarenal artery is originated from the renal vein. We should keep it in mind that the suprarenal gland got three artery supply, and these are from different sites. The artery supply of the ureter. Okay, the ureter, if we divide it into it's a long tube, hollow tube, muscular tube, and it is around 25 to 35 centimeter long. So we will divide it into three parts: proximal part, middle part, and distal part. The proximal part, it gives by the renal artery, which is a branch of abdominal aorta. The middle part from the aorta, and there will be some branches which comes out and gives it supply, such as from the aorta, gonadal artery, and iliac arteries. And from the distal part, it receives its blood supply from the middle rectal artery, which is a branch of internal iliac artery. Inferior mesenteric artery. Internal iliac artery. Middle rectal artery is a branch of internal iliac artery. And vesical artery, internal iliac artery, and uterine and vaginal artery, which both are branch of internal iliac artery. Okay. Artery supply of the urinary bladder. The urinary bladder is supplied by superior and inferior vesical artery, which are the branch of internal iliac artery. Mainly, what internal iliac artery does, it enters into our pelvis, and it mainly supplies all of our pelvic organs and also the perineal area. The pudendal artery, pudendal area, it gives also branch the internal pudendal artery, external pudendal artery, superficial pudendal artery. So these are the other things, but the internal iliac artery mainly enters into our pelvis, and it gives blood supply to our perineum and pelvic organs. So that's why when we enters the pelvis, we see that all the branches are maximum, all the branches are from internal iliac artery or pudendal artery. Artery supply of the penis, it is the male reproductive organ. It receives its supply from the internal pudendal artery, and by giving three branches. This is dorsal artery, this is the yellow one is deep artery, and the red one is bulbourethral artery. All the branches are from internal pudendal artery. Artery supply of the scrotum. The scrotum has two blood supply. Anterior scrotal artery is a branch of deep external pudendal artery. The posterior scrotal artery is a branch of internal pudendal artery. And now the artery supply of the testes is testicular artery, which is a branch of abdominal aorta and originated from at the level lumbar 2. So abdominal aorta, testicular artery is a direct branch. Testicular artery and ovarian artery both are branches of abdominal aorta. Okay. Artery supply of the uterus is uterine artery, which is a branch of internal iliac artery. And already we know that ovary is supplied by the abdominal ovarian artery of the abdominal aorta, and the supply of the vagina is by the vaginal arteries, and also there is some minor vessels from the uterine artery which also gives supplies to the vaginal area, and which is a branch of internal iliac artery. Here is the picture, so we can relate that which are the ovarian artery, this is the uterine artery, this is the internal iliac artery, this is the vaginal artery. Okay, this is all of the blood vessels. I would like to have some questions in both Facebook section and also from our group. So if anyone want to talk, or if you have any questions regarding this, please unmute yourself and ask me any questions if you have any questions. Anyone? May I ask Nishat to unmute yourself? Hello, Nishat. Okay. Do you have any questions, or is it clear? The whole presentation is clear or not?
Yes, Bhaiya. It was a nice presentation and everything is clear to me now. Thank you, Bhaiya.
Okay, thank you very much. Do anyone have any other questions? Okay, someone asked that inferior suprarenal artery supplies to suprarenal gland, which is a branch of renal artery. Okay, everyone is mainly asking that I will upload this. Yes, we will upload this video into our YouTube channel, Spunky Surgeon, and we will upload this also in our group. You can see this live section in our group. Because we have a group called Spunky Surgeon and our page. You can find me there, and we are mainly giving instructions to our juniors, and mainly the fresh juniors. And if anyone want to participate in MRCS exam and they need guideline, we are here. You can find me in Spunky Surgeon and also in my Facebook. There are the links. If you have any questions regarding anything, just do not hesitate. We are here to help you. Okay, that's all for today. Thank you very much. Okay. Okay. Okay, thank you very much, everyone. Good night. Have a nice day.